helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. I'm Hattie Cheek, Dr. Salava, and Dr. Ali back with us today from Marshall Orthopaedics. Some big news. Now, Dr. Ali was just here last time. You have always been what? The full-time joint replacement, the main big shot, Marshall Orthopaedics. But this guy, he is fresh, new. Dr. Salava, what is he going to do for you?
Boy, Hattie, we have looked for a partner for me for 7-8 years.
And you just couldn't find one for the longest time.
We interviewed and interviewed and interviewed. We couldn't find the right person. Jonathon, he's our resident. We trained him for 5 years. He was at the top of his class when we accepted him. He graduated at the top of our class. He was my chief administrative resident. He was the best resident we've had. And he went and did a year of super subspecialization, and he's back with us.
And now he's at Marshall Orthopaedics here in the Tri-State doing work, helping everybody out. Now, what is he going to be doing specifically?
He's going to help me do joint replacements, and you know, our quality, everybody's aware of the excellence in quality that we have brought through the years, but he's going to make that even better. Okay. He's going to reduce our wait times, and he's going to bring some unique characteristics that we've needed for many years so that patients don't leave outside our community to get what they need.
And now are you going to specialize in the knee replacement, and he'll specialize in the hip replacement?
Yes. If you look at elite athletes, if you look at world-class musicians, they all concentrate on one thing. But when you look at expert joint replacement surgeons, we all do a little bit of knees, a little bit of hips, a little bit of redos. But we thought we upped the game even more, so we're all going to concentrate on primarily one thing. So I'm going to do primarily knees. Jonathon is going to do primarily hips and redo operations.
So everyone can be a specialist and know exactly what they're talking about.
Super specialist, that's right.
As if you weren't already, but you've known him for a while.
That's right. Dr. Ali and I have been friends for over 6 years now. He's been a mentor to me as well for the last 6 years. And we first met during my interview trail for residency. And when I came to Marshall Orthopaedics for the interview, I met with Dr. Ali and realized his rather impressive vision. He's very ambitious, and he surrounded himself by other experts in the other subspecialties. And when I interviewed here, I knew right away that this was an excellent fit for me, and feel very blessed to have had the opportunity to train under him and his partners, who are now my partners.
And we're very glad to have you here.
I'm excited.
You're going to be the hip replacement surgery, and you're doing an anterior approach. What does that mean?
So hip replacement surgery has been one of the most successful surgeries that has been developed throughout the history of medicine. There are excellent results, whether you have it done from a posterior approach, an anterior approach, or a lateral approach. What we're realizing now is that through an anterior approach, there is good evidence that there's less muscle damage. And the thought is that with less muscle damage, patients are going to be able to experience less pain after surgery, have a quicker recovery, so that maybe they can get back to the workforce quicker, and we can shorten our hospital stays as well. And this is all done through an anterior approach, so instead of going through some of the muscles, we actually go between muscle groups. And that's where the muscle-sparing nature of the procedure comes from.
Well, I'm pretty sure no one's going to complain about that kind of approach.
I don't think so. Let's hope not.
All right. And now, Dr. Ali, you have this program called the Revision Center of Excellence.
Correct.
What does that mean?
So when you look at the first time, the number of patients that get a primary or first time hip and knee replacement, those numbers are going up tremendously. It's increasing at about 100%. But when you look at patients who are having those components revised because they're failing, that number, that slope is tremendously higher. It's about 600%. And the reason for that is multifactorial, but some of it is because the techniques used are not as good as what we think they are. And in fact, a little while ago, there was a technique that was advertised very heavily around our region about a knee that's more custom for the patient. And this is at the same time that the data was coming out saying that these may fail early. In fact, those knees are now off the market, but we're seeing the downside of that, where patients did well initially, but very early on they're failing and we're having to revise them. To do these revisions, you really need a unique skill set, and most of these patients were leaving our community, going to Cleveland Clinic, Columbus.
So
now we can have it done here.
Yes. Awesome, and that's going to be great for the community. If you need any more information, you just head to our website, click on that Moms Every Day tab. You'll be able to rewatch this interview. And you know, we have a special coming up. I want to remind you of it, and we'll keep reminding you to the